What does or should treatment look like? It can be a bit confusing when you're learning about all of the different therapies that are available to kids diagnosed with autism. Clinically, we tend to call these services behavioral therapy. One of the most well-known behavioral therapies is called ABA, which stands for Applied Behavior Analysis. However, some state services call similar therapies habilitation, or HAB for short. While there are some differences, there are more similarities. For example, both involve directly interacting, teaching, and modeling new skills with your child. Both also involve working with you to learn about your child and to develop strategies to reduce any potential problematic behaviors. The main difference between ABA and HAB is the level of education and training the providers have and the amount of supervision they receive. In ABA therapy, there are two basic levels of providers, RBTs and BCBAs. RBT stands for Registered Behavior Technician. This is the provider who will spend the majority of the time working directly with you and your child. BCBA stands for Board Certified Behavior Analyst. The behavior analyst is the person in charge of developing goals, documenting and analyzing the data, ensuring continued coverage, and training you and staff. Most importantly, the BCBA provides ongoing and frequent supervision of the RBT. This ensures that the RBT is implementing the best interventions and is working on skills that are the most important. The BCBA is required to meet with you, the RBT, and your child in person on a regular basis, which depends on the amount of services your child receives. You and the BCBA should also meet regularly, at least once a month, so you can be included in determining what skills they are teaching and that these skills are important to you and your family. With habilitation, the supervision requirements are a little more vague, but the statutes state that a support coordinator needs to meet with you at least every 90 days. HAB and ABA are similar, but the requirements for supervision and training for HAB are somewhat less intensive. However, and this is key, both HAB and ABA should involve you as parents into every aspect of therapy, so you not only understand what's being taught, but also that you have the opportunity to communicate and have the final say in what is being taught and how. Behavioral therapy can look very different for different families. Sometimes treatment happens in your home, sometimes it takes place in a clinic or school setting, and sometimes it's a mixture of both. Where therapy takes place depends on the agency or company you're working with, and can also depend on the age of your child and what skills they are working on. No matter where the therapy takes place, you will notice that a lot of data and notes are being taken. This is because BCBAs use this data to monitor progress and to make sure that your child is learning the best they can. They will share this data with you, many times in the form of graphs and easy to understand tables. Finally, your BCBA will also have one-on-one time with you to help you understand all of the data and to make sure all of your questions are answered. Watch the next video to find out more about educational opportunities and where your child can go to school.